Hello everyone, my name is Hazlin from Group 25, and for today's video I'm going to explain and share how to deep breathing and coughing for the patient after the surgery. Deep breathing and coughing exercise, which are very important to do after your surgery, is to keep your lungs clear. We will start the exercise by asking the patient to sit up nice and straight. Next, ask the patient to take a deep breath in through your nose and out through pursed lips. Following that, advise the patient to take a deeper breath and to expand their rib cage so that their lungs may fill. Continue the exercise by asking the patient to hold their breath for 3 seconds before exhale. For the coughing exercise, ask the patient to hold a pillow against their incision, which will provide a little support and alleviate some of the discomfort. Once again, ask them to take a deep breath through their nose and then cough for exhale. So that's all for me. Thank you for watching.